Welcome to this presentation on the New South Wales Work Health and Safety Act. As leaders in your organisation, you set the standards for how occupational health and safety, or work health and safety as it is now known, is managed. Importantly, when workers see work health and safety as part of the work culture and actively promoted and supported by management, they are more likely to work with you to help achieve a safe workplace for everyone. As part of a series, this presentation is designed for executive and senior administrators. There are two other presentations in the series, one designed for frontline nurses and midwives, and the other presentation for managers and supervisors. A guidebook entitled WHS Essentials for Nurses and Midwives supports all presentations and provides more detail, including many examples relevant to the health, aged care or community sectors. The Association acknowledges the support of WorkCover New South Wales in providing funding for these resources and trusts you find them useful for designing and implementing initiatives to achieve a safe workplace.
In 2008, the federal government committed to provide consistent health and safety legislation across Australia. This resulted in model legislation which was adopted in New South Wales as the Work Health and Safety Act, in force from January 2012. The WHS Act provides the framework for protecting the health, safety and welfare of workers and others at the workplace. It outlines who has a duty under the Act and their responsibilities. It defines specific obligations such as risk management, consultation and worker education. And it provides for compliance and enforcement. The WHS regulation provides the detail on how the duties prescribed under the WHS Act must be performed. Practical advice on specific aspects of the legislation can be found in the Codes of Practice and Guidelines, many of which are relevant to the work of nurses and midwives.
So it's an exciting time for us. We've got the opportunity to design a new purpose-built maternity service, and that includes a labour and birth room that's a lot different to our current high-tech environment. So we've been working with the occupational health and safety consultants, and they've been coming on site with us as well as the architects to actually walk through what our environment will look like, and that's about space between the edge of the bath and where the clinician would sit. That's access for the women who might need to use a wheelchair, and it also looks at the needs of bariatric women, which is increasing needs of our clientele.
The legislation identifies three main duty holders: the PCBU, officers and workers. PCBU replaces the term employer. PCBU stands for the person conducting the business or undertaking. The PCBU can be an organisation, such as a hospital, aged care organisation, nursing agency or university. Or it can be an individual, such as a partner in a medical practice or someone who engages a nurse or midwife privately. A PCBU can also be a nurse or midwife who operates as a sole trader. The PCBU is the principal duty holder and must ensure, as far as is reasonably practicable, that the workplace does not expose workers and others to health and safety risks. This duty is not limited to employees. It applies to any worker whose work is influenced or directed by the PCBU, such as agency personnel and contractors. It also applies to others at the workplace, such as patients and visitors. The duties required are comprehensive and include ensuring that the work environment and systems of work are safe, providing information, training and supervision, establishing and maintaining worker participation in WHS, including consultation and issue resolution procedures, providing facilities for workers' welfare, monitoring workplace conditions and the health of workers exposed to specific occupational risks such as radiation, notifying WorkCover New South Wales of certain incidents, and establishing effective dialogue on WHS issues with other PCBUs, such as service providers that work at the workplace. Reasonably practicable is the standard required of the PCBU to comply with its obligations under this legislation. It means that the PCBU must take all reasonable steps to manage WHS issues. It's a balance between what is known about the risk and the ways to eliminate or control this risk, the time and effort involved, and after all other considerations, whether the cost is disproportionate to the risk. The PCBU must not expose workers to a lower level of protection because it is less financial than another PCBU. If the PCBU cannot afford to implement essential controls, then it should not undertake the activity.
In our facility, we have a secure unit that houses acutely mentally ill patients. It wasn't built for purpose in its day, and it probably isn't reasonably practicable to actually rebuild it today, currently. So the organisation decided that we had to look at the environment, we had to change something to make it safer. So we consulted with our staff, all the clinicians, doctors, nurses, allied health, and we came up with a series of modifications to the environment that in consultation we thought were safe for patients and staff to use. And the staff and even patients have commented that it is a safe environment as it stands at the minute.
It's important as leaders that we take the responsibility of doing what we can to drive a continuous improvement process. We can make a healthy and safe workplace if we put our minds to it. If we share in the communication role and responsibility, we can drive that process through good leadership.
As an organisation, a PCBU makes decisions and acts through individuals. It cannot comply with any duty unless those who manage the organisation, its officers, make the required decisions to ensure compliance. So who is an officer? An officer is a person who makes or participates in making decisions that affect how the organisation operates. Whether you're an officer is determined by how much influence you have on the decisions affecting the whole or substantial part of the organisation. So you're an officer if you're an owner or proprietor of a PCBU, such as an aged care facility or labour hire nursing agency. You're a board member or director. You determine and have control over resource allocation for a substantial part of the organisation, or you determine the strategic direction of your organisation, such as an LHD Director of Nursing or Midwifery or CEO of an aged care facility. Officer is a legal term. Even if your job title includes the term officer, executive or even director, you are not necessarily an officer unless your responsibilities and authority conform to the definition of the legislation. Your contract of employment should specify the scope of your responsibilities and help clarify whether you're an officer. If you're in any doubt, you should contact the association or seek independent legal advice. You need to know because the legislation prescribes duties based on your role. If you're not an individual PCBU or officer, then you must be a worker, albeit with managerial or supervisory responsibilities. This series includes a separate presentation for managers and supervisors. It's also worth noting that some nurses and midwives take on director roles on professional boards and foundations associated with their work. If the organisation is a PCBU, then you would be an officer for this role, even if the role is voluntary. So, what are the duties? As an officer, you must actively take steps to ensure that the PCBU complies with its duty. The standard is due diligence. Due diligence means taking reasonable steps to keep your knowledge current on WHS matters, especially those risks relevant to your sector. Ensure WHS systems and practices are effective. Allocate sufficient and appropriate resources for safe work. Ensure you have effective systems for receiving and dealing with WHS information, such as incident reports. Act on unsafe work practices, conditions and incidents. Report on safety performance, such as at board meetings and through annual reports. Retain people with appropriate WHS expertise, and ensure that WHS is considered in all decision making. As an officer, you are responsible for your own actions or omissions. You can delegate tasks associated with your role, such as employing a WHS advisor or engaging a consultant to train your workers. However, you cannot delegate your duty. You are responsible. In workplaces such as hospitals, aged care and other healthcare facilities, work is performed by many people, not just employees. The term worker embraces everyone who does work in the workplace. Workers' responsibilities are limited to taking reasonable care of their own health and safety, which includes the right to refuse to do work which the worker believes is unsafe and exposes them to imminent harm, taking care not to put others at risk, complying with reasonable instruction and, once advised, cooperating with WHS policies and procedures. While officers are assessed against a standard of due diligence, for workers the standard is reasonable care. Assessment of a worker's failure to take reasonable care is balanced against a number of factors, 3 of which are under the direct control of the PCBU, specifically what safety systems were in place at the time, what training, instruction and supervision was provided to the worker, and whether the worker was working in their usual role. Patients and visitors also have responsibilities not to place anyone at risk. It is unacceptable for anyone to refuse to cooperate with safe work procedures, make unreasonable demands, bully or threaten workers. Patients and visitors are also accountable for any criminal behaviours, such as assaulting workers and interfering with safety equipment. Information on these responsibilities and what can be expected for non-compliance should be communicated to patients and visitors. You need to be aware that for all duty holders there are penalties for non-compliance with the legislation. The penalty for an officer can be up to $100,000 for the lowest category offence. For higher category offences, such as reckless conduct, penalties can be up to $600,000 and also include a prison sentence. Because of the separate duties and standards under the WHS legislation, it is possible for an officer to be guilty of an offence independent of the PCBU's guilt for the offence. As an officer, you have a key role in shaping the safety culture of your organisation. A key component is ensuring that the systems meet compliance requirements and, like any quality program, aim for continuous improvement.
The management of aggression within mental health is a fairly significant issue for all staff. It's one of the issues that we've looked at largely from a wider perspective and identifying issues to help people manage in these situations. One of the key things that we have done is increasing the management aggression training package from 1 day to 3 days, incorporating a lot more new strategies to enable people to more effectively deal with challenging aggressive behaviour. It's turned out to be a positive, worthwhile series of events. Most staff are very appreciative of the extra training. They're learning new skills, and most of them are now expressing the thought that they're very confident in managing aggressive situations.
WHS Essentials for Nurses and Midwives provides the structure for a robust safety system, and we encourage you to take the time to read this guide. However, for this presentation, we focus on just 4 issues: consultation, risk management, issue resolution, and notifications to work cover. Most organisations have well-established health and safety committees. These committees remain an important mechanism for dealing with organisation-wide issues, such as assisting in the development of WHS policies and monitoring the effectiveness of strategies to address WHS issues. For dealing with local WHS issues, health and safety representatives, or HSRs, are recommended. HSRs are elected to represent workers in a work group, which is a group of workers who perform similar functions or work in defined areas. HSRs have a number of functions, but essentially they represent workers and negotiate with local management on WHS issues.
As a health and safety representative, it means that I'm quite important on the ward because I have to attend those meetings. I need to inform the committee if there's any issues that can't be addressed on the ward, and vice versa. I need to let my colleagues on the ward know if there's any important issues coming out of that meeting.
HSRs and their deputies are elected for 3-year terms and have certain powers, which include directing unsafe work to cease, issuing notices to correct anything that is unsafe, and requesting assistance. Assistance may come from WHS professionals, WorkCover, or the WHS professional officers from the association. While the training is not mandatory, the association recommends all HSRs undergo training to fully understand and carry out their role. The HSR training can be also a great way for frontline managers to understand their role in WHS. The association believes the best WHS outcomes will be achieved with both HSCs and HSRs. Other arrangements are possible, so all workers need to be involved in determining the best approach for their workplace.
So with the design for the new building, we've had work health and safety consultants sit on all our design meetings, and we've gone to them for specific concerns we have about heights of benches, baby baths. We've also had infection control involved, and the consultants have come down to our mock birth room to actually physically work with us alongside to work out sort of best use of the environment.
The duty to consult extends to other PCBUs that work at your workplace. This doesn't need to be a complex process, but you must be able to show you've had dialogue with them about anything that could affect their workers at your workplace. And you need to ensure that your contractual requirements, workplace and other work practices don't put their workers at risk. Risk management is critical to ensure a workplace remains safe. It involves identifying hazards, where necessary assessing risks, eliminating hazards and therefore risks, or if this is not reasonably practicable, controlling or minimising the risk and reviewing the controls to ensure they remain effective. Risk assessment is used to determine the risk of a particular situation and then develop documented strategies to eliminate or control that risk. It's a structured process involving a number of people, using standards and assessment tools, including those for specific hazards like manual handling or chemicals.
With the design of our new facility, we've had the opportunity to work with all our staff. They've all played a really important part. They've had the opportunity to look not only at their own personal space and what their requirements are, but also how they all link in with each other.
Risk assessment must involve workers. After all, they are working with the hazard or potential risk. Nurses and midwives have an established track record, providing valuable input to the risk assessment process, along with identifying best practice solutions that are workable for the specific workplace. However, it remains the responsibility of the PCBU to coordinate and lead the process for risk assessment. Officers need to ensure that they have the appropriate systems in place for risk assessment, including being alerted to the outcome so that they can deal with any recommendations. While the main focus of risk management must be the elimination of risk, if that is not reasonably practicable, then control measures based on the hierarchy of control must be put in place. While training workers is an essential component, it must not be the only means for controlling risk. Where a WHS issue poses significant threat to anyone, or where a matter has remained unresolved but continues to be a problem, the legislation mandates that there must be reasonable efforts to resolve it. The legislation outlines a suggested or default procedure. However, every workplace must have an agreed written procedure for resolving WHS issues. All workers should be advised of this procedure. As part of the process for resolving the issue, the PCBU must be represented by someone with sufficient authority to negotiate on its behalf. If the workers are part of a work group, the HSR must be involved. If workers are not part of a work group, they can negotiate themselves or nominate a representative, such as the association. For issues that remain unresolved, WorkCover will assign an inspector to assist, bringing the matter to resolution. The legislation requires serious workplace injuries or illnesses and dangerous incidents be reported to WorkCover New South Wales as soon as the officer becomes aware of the situation.
The other area they can report safety issues to me is through our IMS program, so that's the computer based. So if I'm not here and they won't see me, they normally leave me a note or a phone call, but there is the mandatory reporting system through our computer system.
As the responsible officer, you may not be at work when the serious incident occurs. However, you are deemed to know when any supervisor or manager becomes aware of the incident. So you need to have systems in place to ensure that this happens and that the relevant personnel know what to do.
You remember the incident that we talked about yesterday? Look, we really do need to report it to WorkCover. So I've got a fact sheet here which outlines how we go about that. Okay.
Following notification, WorkCover may issue a non-disturbance notice so that the equipment or environment remains as it was until they have investigated. Importantly, some incidents may require reporting to multiple agencies. For example, if a sling on a hoist fails and a patient falls, irrespective of whether there is an injury, the incident may need to be reported to the Department of Health, the Therapeutic Goods Administration and WorkCover New South Wales. Incidents such as assault, robbery or hostage situations should be reported to the police and WorkCover New South Wales. The association is both a professional and an industrial organisation. It provides assistance to individual members, including officers and the organisations for which they work on WHS issues. The association also provides support and advocacy to members who raise WHS issues, including negotiating on behalf of workers to resolve WHS issues. The association's WHS professional officers, as well as some organisers, hold WHS entry permits. This enables them to investigate WHS issues on site at any workplace where nurses or midwives work.
Work health and safety should be a part of core business. Once it's core business, it becomes the culture of the organisation. Once it's the culture of the organisation, it informs all business decisions. The new work health and safety legislation has enormous potential to improve safety outcomes for all of us.
The association hopes you have found this presentation a useful introduction to your role under the Work Health and Safety Act. More detail is provided in WHS Essentials for Nurses and Midwives, along with best practice examples for nurses and midwives across a range of working environments. The guide also includes a comprehensive list of WHS resources for you to explore. You can also contact the association for more information or assistance.